I thought, before we let Eric go, because I know we take up a lot of his time and he's, been incredibly generous to give it to us, but I thought maybe it'd be fun to go through just a couple of quick little cases that Eric and I shared together in our 12 years together with the teams here in Washington that truly happened. These are truly, cases that we work together with to kind of demonstrate that communication, that multidisciplinary link, and kind of how it worked. One of them was actually an orbital fracture. So I don't know if you remember that was quite a while ago, but one of our players, and it's funny, I had our NBA physicals this morning, and one of our young players new to the team actually had the exact same thing happen to him in college last year, orbital fracture, exactly the same situation that you and I went through, Eric, with a player going up for a rebound, the other guy's coming down, elbow gets into the socket the wrong way, blowout fracture in the bottom of the orbit. And, again, in our situation, it was a bit more serious than this situation. We ended up having to go through a surgical correction. But in this case, obviously the trainer was still the first one on site. Trainer was the first one to identify the situation. Team physician in the locker room helped to, again, identify where we go with it. And our first, referral was to our team ophthalmologist. So our team ophthalmologist, dealt with, what needed to be done from a medical standpoint. In this case, we referred him out to surgical correction. And after the surgical correction, we were left with a bit of double vision. I don't know if you remember this, Eric, right?
Yeah,
so
sure.
Seeing double vision.
It's a rehab program now.
Yeah, and it's exactly what it was.
A lot of people gloss over that. Yeah.
Yeah. I mean, when's the last time you've gone through an ACL repair without physical therapy?
Right.
Right? So we are the functional physical therapists after the ophthalmology repair. And in this situation, we worked through, several weeks, potentially several months. I don't remember. It's been so long ago, of doing some muscular rehab and visual training at the, again, direction and encouragement of the ophthalmologist of the team to gain back functional skill sets and eliminate this athlete's double vision. I mean, this really was career threatening at that point with the fact that he healed, but healed with, a bit of, double vision from a vertical imbalance in the eyes. And after some time, we got him back. We eliminated the double vision and ended up signing a contract extension and stayed with us for another probably 4 or 5 seasons.
Yep.
So, I mean, you want to speak to that communication and kind of how that worked through and what your experience was on that? Because I think that was a perfect example of kind of how we do work together.
Well, I mean, your point that what happens if that happens on one of your teams and you don't have somebody who's taken an interest and has an expertise in sports vision, rehabilitation and that aspect of things, and from a performance perspective, you're behind the 8 ball now because there's no one to do it. I never studied that. I didn't know how to do it, but this is incredibly important, especially if it's a baseball player or somebody who takes a baseball to the eye and they have a long road ahead of them to rehab back where they can track all of the input that the sensory input that you need and how that is going to be output again. All those things would go, undone if it didn't have somebody on staff like that. So yeah, I mean, you played a very important role, and maybe the most important role in having that to be a good outcome, not only for the team but the athlete. So.
And the other one I had, I mean, we could go through some concussion things in studies, and there's a lot of things that we've done together with, visual intervention and contact lens wear, glasses wear, laser vision correction. I mean, I think one of the things that you and I have talked about through the years is the lack of studies related to basketball, and vision. And the slip of the tongue there is because there's a multitude of studies in baseball relating baseball and vision and the importance of vision, but we don't have those studies through the NBA or through basketball as a sport. So we'd certainly encourage, athletic trainers and optometrists and docs who work with a team to develop a study and to give us some data points on, what's average acuity in the NBA. We don't know that. We don't even have that, right? What's the average acuity? What do we need to be a good basketball player? Do we need to have 20/20 vision? We assume as functional specialists that we want to maximize vision, clarity, and function, but we don't have data points that we're trying to match up against like we do in MLB, for instance. So, I think those would be great relationships for us to try to foster through this website. And what we're trying to do is encourage our colleagues and our individuals from an athletic training and optometry standpoint to create those relationships that lead to studies, lead to research, and answer some of those questions for all of us. But the one other case I wanted to go through, which I think was kind of a fun one for us to talk about, was really going back to the relationship that we built. And there was a player that was actually sent into my office that we traded mid-season, so he wasn't part of the preseason evaluations. When he came to our team, the only reason he came to my office was because he needed his driver's license renewed. He had an out-of-state driver's license, and he was referred over to our office to get a quick little vision test to get his driver's license renewed. But, again, we don't do anything quickly. So we sat down and tried to do as thorough of an evaluation as we could. And going through the correction, the individual had 20/20 vision, good clarity. But looking at his retina and doing a full evaluation of his internal health, he had a huge retinal detachment, a retinal detachment that was so close to the central vision, that it was unbelievable that it wasn't detected through college. And in discussing with the athlete, he said, yeah, I remember taking a good shot in college and kind of seeing stars for a while, but no one told me there was really anything wrong. So I just kind of went back on the court and played, and now I'm in the NBA. And, that was an interesting one because what we said was, look, from a functional standpoint, I don't feel good about the guy going back on the court. Now that I know it's there, that's my credibility on the line, without relaying that to our trainer, who then had to relay it, which, again, wasn't a wonderful conversation. I can only imagine from your end to the general manager, to the coach, to say, look, I don't know that we can let this guy play unless he's protected. And so the aim came in with putting on a pair of sports glasses and being protected. Again, no prescription in them, but only for a protection standpoint. And then we had the player's agent, we had the player's wife saying, you're not wearing these glasses. It makes you look silly on the court, or something like that, right? I mean, there was basically the example, who's this guy? He doesn't know what he's talking about. And you had my back in that instance of saying, look, we have some real reasons here to worry about your safety playing. And we were able to do some imaging and show them where that was. But I think that was a really interesting one to go back to, just the relationship that we built over time that allowed us to go through and communicate that throughout the team, and eventually encourage this player to wear safety glasses. And he wore them for another, 4 or 5 years on the court. He continued to play in the game after we identified that.
Yeah, he'd been playing in the NBA for 10 years. And through all of college, and so that was a big adjustment for him to have to look at having to wear goggles, because that's an adjustment that's significant, to put on safety glasses or safety goggles to play professional sports. And it was a team effort, to try to get him convinced to do it, and it was the right thing. And we actually included his former ophthalmologist that he had at his previous team, who he had a relationship with, who also convinced him that it was the right thing to do. So yeah, if we didn't have that, you never know what could happen. That was a large chronic detachment that it could have gotten worse, no doubt, right? I mean, so
yeah, all it took was one more shot.
Yeah, that was a win.
That's actually one of the situations that we look to hopefully build from an optometry standpoint too, is actually the network. I mean, we actually did refer to Dr. Horn before. I mean, it was a couple of seasons ago, but we had a situation with a player on the road, and you guys happened to be playing the Trailblazers, right. And we picked up the phone and called Dr. Horn and got that player in. And you can do that and people have asked me sometimes, hey, do you travel with the teams? Do you go with the teams? Now, I'm on staff for all of our playoff games. I'm on, at home, but I don't travel with the team because we expect that the team eye doctor will take care of our players when we're on the road, right? So in that situation, it was great because I had the relationship with Dr. Horn to be able to do that. But, we're not lucky enough from an optometry standpoint to have the network that the orthopods and things like that do at this point, and that needs to be built up. We need to have that connection, that network that we can pick up the phone and say, hey, we're on the road in Dallas. Dr. Cunningham's right there. Let's have him taking care of it. But, that's something that obviously is hugely helpful to you as you're on the road with the relationships that your other medical professionals have with their colleagues. So I think, obviously that'd be something that I'd ring the bell for us as a profession too, to kind of build that network, because you guys are a tight network from a trainer standpoint. Every trainer on every team, first name basis, and we're on the road with something and you don't have something in your medical pack. You can go to them in the spirit of the game, in the spirit of science, and say, hey, I need something, and they're never going to turn their back on you, right? I'm thrilled and excited. This is such an awesome opportunity. I just want to thank you again, Eric.
Thank you. I appreciate it. It's fun to talk.